Okay, a couple things too. I think I told you already, but put the blood pressure cuff in the black bag. You don't want to take the box with you. Take the stethoscope in the box. Other thing, I think I mentioned it to everyone, when you're in a healthcare setting, please make sure you have a watch, a smartwatch, whatever you have that has the second hand on it, okay? Do not depend on your phone. What if you reach your phone somewhere? You can't get to it. You're not going to be able to check patient's pulse or respiration without being able to time on the second, okay? All right. So just a couple things we're going to go through real quick. Sorry, I got to figure out how to make this work. This is different. I feel like I'm in Hollywood or something. Okay, so grab out your, and I said everything, like grab out a notebook or something to write off just a couple things, okay? We're going to talk about urine for a minute. Everybody pees, right? So urine something that urine something that you're going to be handling pretty often in an office setting, okay? So. Has everybody seen one of these cups before? Okay. So, a couple different types of urine. Yeah, a couple different types. There can be two different types of specimens, sterile or non-sterile. Okay. For sterile purposes, you have to make sure that you're not touching the inside of the container, or nothing is going into the container except the urine. Okay. All right. So, what should go on the cup? What should you tell the patient to do? Name, date of birth. Also, the time is important because for a lot of urine specimens, if they have increased bilirubin or anything else in it, the light is going to affect the contents of this. Okay, so you need to have the time to know when it was completed so that you know when to have it tested by. Okay. In some situations, they'll tell you if you cannot get to the testing of the urine, it needs to be put in the refrigerator. Okay, so the light does not affect the results. All right, a couple different types. Random urine. That's something like you'd see if you were pregnant and you're going to the doctor's office to get a random urine to test it, okay? That is not something that is sterile, okay? It is first morning urine sample. This is something to know. It's not something you'll necessarily be tested on. What does that mean? First morning. So, yes, so your urine is most concentrated first thing in the morning. That's why they say take a pregnancy test first thing in the morning. It's a higher chance that if it is positive, it's going to show up positive in the early stages because your urine is so concentrated. Okay? First morning urine, you have to tell the patient exactly what you just said. When you wake up in the morning, your first void. Void means when you go to the bathroom. Okay? It could mean urine, it could mean bowel movement. First void in our terms is urination. Okay? First void in the morning, we want you to put that into the cup. Bring the cup back to us with the time, the name, the date of birth. Okay? All right, so random, like I said, not scheduled, no advanced preparation needed, okay? Midstream clean catch, who's heard of that? All right, so this is a patient, you're testing the urine because maybe they have UTI symptoms, okay? So what are we gonna do? Huge part of it is educating the patient how to do this. A lot of people don't understand what it means to do a clean. Go ahead. Yeah, go ahead.
Are they supposed to be a little bit and then wipe?
Yeah. So, well, clean first. They're going to give you a little towelette. So you want to teach the patient to clean the whole area. Middle, side, if it's a female. Okay? Clean the entire area. If it's a male, clean the tip of the penis. Start voiding into the toilet. Okay? The first little bit of urine is not put into the cup. They need to start going to the bathroom first. Then put the cup under. Catch that part. If they have too much to put in the cup, please explain to them that they can finish peeing in the toilet, okay? Because you will have patients that it will literally be dripping out of the sides because it's so full. We just need, half a cup. Half of this cup is plenty for testing, okay? Okay, the idea of midstream clean catch. you want a sterile specimen. Does everybody know that urine is technically sterile? If it doesn't, if there isn't a UTI, if there isn't bacteria growing in it, urine is actually sterile when it first comes out. Kind of cool. Okay, another type of urine testing, 24-hour urine. This is somebody who will go home with a container that almost looks like a little urinal, okay? The idea of that is it's somebody who maybe they're checking their kidney functions to see how they are throughout the day. So 24 hours, you're gonna have to instruct them that, excuse me, sometimes there's a preservative put into it, sometimes it needs to be refrigerated. You have to check on your office's policy for that. But the point of this is 24 hours worth of urine in this container. They write the time on the container when they first urinate. That first urination does not go in the container, okay? First urination is discarded, is flushed. That time is written on the container, and then 24 hours from that time, so 24 hours later, is when they need to be putting all that urine into the container. Some of these patients are ones that maybe you need to send them home with one of those hats. Have you guys seen a hat that fits into the toilet before? Okay, these are patients who then they can literally pour it into that 24-hour container. Okay. All right, catheterization. Urinary catheterization is something that you can see in the doctor's office. It's not very common. If you're in a urology office, you'll see it a lot, but in a family practice, it's not anything that's too common. What you guys need to know from your perspective is you're the helper, okay? So if you're doing a straight catheter, it is literally a straight tube. To be able to put a catheter into a patient is considered a sterile procedure. We will go over, hopefully in 2 weeks, we'll go over how to put on sterile gloves. But a sterile field means literally whatever is put out that needs to be used for the patient is sterile. You cannot touch it, you cannot see on it, you cannot cough on it, you can't walk over here and touch the mouth and then touch something else. You're putting on sterile gloves, you're opening the field, which is literally like a drape cloth, with the contents of what they need for the catheterization. Nothing else is touched, okay? Until you're assisting with the patient. For a straight catheter, the idea is it's for a patient who maybe can't urinate, or it's for a young kid who they think may have a urinary tract infection. So you are inserting the catheter. This is usually the provider, okay? The area is going to be clean. You're going to insert the catheter. The urine will come out into tubing, and you will put it into a container to be tested, okay? For your purposes, this is a sterile technique, okay? So that is what's most important for you to remember, is it's completely sterile, sterile gloves, sterile field. You're not touching anything outside of that sterile field, okay? And this is, culture and sensitivity is usually something that's going to be ordered from that catheterization. Now, straight catheter is something that's very short term. Literally, it's a straight tube. You're getting the urine out. You're pulling this catheter out. That's it. Does anybody know what the indwelling catheter is called? What are they often called? Starts with an F. Has anybody heard of the term Foley catheter? Okay, a Foley catheter is an indwelling catheter that is, you'll see like patients in a nursing home type of setting where they have a constant catheter in. That's one that has more of a softer tubing that's going to stay in the bladder that has a bag attached to it. The bag's going to catch the urine, okay? Both of those are considered sterile procedures, though. Almost done, guys. All right, the other thing with urine, drug screen. Most of you in here have had some sort of urine drug screen, whether it's at your job, whether it's to get accepted into a school, into a program. If you're performing the drug screen in an office setting, your office is going to have a policy on what's to be done. That may mean you have to stand there and watch a patient go to the bathroom. You may have to put tape on the flush so that they can't actually flush anything. They may put blue dye or a certain color dye in the toilet to make sure they haven't tampered with anything. Follow the policy and procedure for your office for that one, okay? But urine drug screens are something that are common, especially with like VDOT employees. Department of Transportation employees have to be drug screened every year. You will also have some offices some businesses that will send their employees there for random drug screens, okay? That's more of like a family practice type of setting, not a specialty. Okay, pregnancy test. Also a urine test in the doctor's office. They can do a blood test, but often you'll see the urine test. So that's measuring HCG. Has everybody heard of that before? Human chorionic gonadotropin. It's a huge word. HCG CG is what they're testing for. So you're going to be dipping that urine, usually with a stick, okay? You're going to take the stick out. It's either going to be 1 line or 2 lines, okay? This is pretty direct. The one thing to remember with pregnancy tests is like that first morning specimen with other testing, you're going to want to tell your patients that if they're testing at home, first thing in the morning, urine's more concentrated, try testing then, especially if it's early in the pregnancy, okay? If they've had too much to drink, if they're too hydrated, their urine's going to be less concentrated, so it's more likely to have a false negative. They really could be pregnant, but because their urine isn't concentrated enough, it's not picking enough of that hormone up. Okay? So, urinalysis. So, to go over urinalysis, when you are checking one of these, let's say somebody's coming for a physical, you have them do a midstream clean catch into the container. First thing you're going to do is look at it. Color, clarity, can you see through it? Is it clear? Is it yellow? Is it orange? Is it brown? Okay, you're gonna look at it. That's your visual, your physical side of it. So, specific gravity is something you're gonna test with urine. What does that mean? It's totally confusing. The idea of specific gravity is that you're checking to see how concentrated it is. If you've had a lot to drink, your number is gonna be very different than if you're dehydrated and have had nothing to drink, okay? So, the more dilute it is, the more you've had to drink, the lower the specific gravity. We're looking at a number here, 1.005 to 1.030. Okay, 1.030 is high on the spectrum, which means that you're extremely dehydrated. Okay. What you guys need to know in terms of that is that there will either be a machine that you put the urinalysis stick into, or you will pull the stick out and read the stick after you've dipped it in the urine, and each little square will have a different color. And you'll see that in your chapter. There'll be a spot for specific gravity, and they'll tell you what that number is. The machine will tell you the number, or you'll identify it based on the color on the tube, okay? So things you're looking for in that urinalysis. Protein. Protein is not something that you want to have in your urine, okay? If it comes up positive, you'll be able to tell based on that dipstick. Also ketones, that's also not normal. That's, and when you open the container, you can actually smell a fruitiness. That means they have ketones in their urine. Okay, has anybody heard of the keto diet? Yeah, that's common right now. The idea of that is people are intaking high fat, and so that fat is being broken down in their urine. You can actually smell the ketones in their urine. So keto diet helps with weight loss, but it's definitely very noticeable when you're testing urine. Other things in the urine, bilirubin. So if they have bilirubin in the urine, it's going to look a different color. It's going to be a yellowy, orangish color within the urine. That bilirubin is one of the things, that's one of the reasons why you don't want to leave urine out to test later. Light will affect the bilirubin levels. Okay. All right, hematuria. I want you guys to know that word. H-E-M-A-T-U-R-I-A. Hematuria. H-E-M-A-T-U-R-I-A. Does anybody have any idea what H-E-M-A-T stands for? Hemat. Means blood. Okay? Urea, urine. Hematuria. H-E-M-A-T-U-R-I-A. Hematuria means there's red blood cells. There's blood in the urine. That is not a normal finding. Sometimes you can actually see the blood in the urine, okay? Sometimes it needs to be tested to find out that there are red blood cells in the urine. All right, another thing that you're testing for in the urine is nitrites. So if you have some sort of bacteria or some other microorganism within the urine, the nitrites are going to show up positive, along with leukocytes. This is a lot of information. I totally understand that. I just want you to hear these words so when you read it again later in the semester, you're like, oh, I think I heard that before. Leukocytes. Leukocytes and nitrates. When you have a patient with a UTI, both of these things are going to be positive and they're going to be in the urine, okay? So that's all you need to know about that. Bacteriuria. You don't need to write this down. Just listen to the word. Bacteriuria. Urea is in the urine. So what do you think is in the urine? Right. Okay. All right. Next thing, fecal specimens. I'll show you just a couple. I'm gonna keep you guys here about 5 more minutes, okay? Is anybody on a tight time schedule? Okay. Are you on a tight time schedule?
Kind of.
What?
Kind of.
Okay, yeah, I'll give you 5 more minutes. If you need to go, that's fine. I can send you the Zoom link. Okay, let's talk about fecal specimens. These are those fun things that you get to do in the doctor's office, like play with people's poop. Disgusting. But it's a great reason to wear masks. Also a great reason to wear gloves, okay? One of the things you're going to see if you're working in an office where they do a lot of adult physicals, if you've got patients over 50 years old, you're going to be testing fecal occult samples, okay? Occult means blood, hidden blood, okay? So hidden blood in the feces, fecal occult sample. You're going to be sent a little card. I was trying to find a card here. I'll show it to you guys next time if I don't see it here. Patient's going to be sent home with a card. They need to put a small amount of feces on that card for 3 days in a row. If they have 3 bowel movements in one day, that's great. Don't use all 3. 1 bowel movement a day. If they don't have a bowel movement every single day, put a smear on every time they have a bowel movement, okay? So, send them home with everything they need. Give them some gloves. Give them one of those hats that you put into the toilet. That's the best way to handle it because they suggest giving them a paper plate and a popsicle stick and letting them poop onto the paper plate. That's not really realistic for a lot of patients, especially ones that are well over 50 years old. Give them a hat. They need to use that popsicle stick that comes with this little card, and they need this, literally this much, a tiny little itty bitty bit amount of feces. Instruct them not to let it ooze out onto the card because they're going to send this back to your doctor's office and you're going to open it and it's going to have feces smeared out from it, okay? Very tiny bit, three times over 3 days or however often they have bowel movements. Your job is to flip that card over. On the opposite side of the card, there's a reagent. You're going to put a certain number of drops onto the back of the card. If it turns blue, that means that there is blood in that feces, okay? So what does that mean to the doctor? That means we need to do more testing. Maybe we need a colonoscopy. They could be at risk for colon cancer. They've got some sort of bleed within their gut somewhere that we need to further investigate, okay? It's a really great way for them to identify a possibility of a colon cancer without ever doing anything invasive. All right, other thing with feces, ova and parasites. These cool little containers. This is like if you think somebody has pinworms, if they've picked up some sort of parasite. If they're sent home with these, they're going to take them home, they're going to return them back to the office. They come with a little tiny spoon inside of it that's attached to the lid. So they need to fill all 3 of these containers up. And there is a line that says, add specimen to this line. So they literally need a tiny little spoon of milk. We're going to put that in, we're going to seal it up, seal the bag, bring it back to you, okay? This is going to be sent away to a lab. This is not something you guys will be testing at the office, okay? Also, bacterial and viral. If they're worried about something bacterial viral, they'll give you a container like this to send home with the patient, just like they would a normal urine container. They'll bring this back, make sure the patient identifiers are on it, and it's going to go to the lab. Okay. All right, last thing, sputum. Does anybody know what sputum is? Mucus, spit, okay? So if you've got a patient who has potential pneumonia, let's say they want to do a culture of their sputum to figure out is it a virus, is it a bacteria, could it be some sort of fungal infection? What they're going to have you do is send them home with a container, and you want to instruct the patient when they first wake up in the morning, their first coughing fit that they have, you want them to take really big, deep coughs as hard as they can and expectorate, get out whatever they can to come up. They need to spit it into this container. Same thing, identifiers on this, name, date of birth, time, okay? Sputum will be sent away to the lab to be tested. The other way that they can do it too in an office setting, if they have the correct equipment, they can actually go down a tracheal tube, suction it up. What they gather from the suctioning, they can put, it would have you as a medical assistant put into a sputum container to be sent out. Okay, more often than not, they're going to go home with a container to get something up and put into themselves. Only other thing I want to show you guys, and you're ready, you're free to go. Most urine containers now will come looking like this, and it actually has if you can see within the container, with a little tip down there. If you look at the top, you're actually going to use a specific type of test tube to poke into the top. You guys are getting an easy way out here. You don't even have to ever open the container. You're gonna poke the test tube into the top, and there's your urine that you need to send out for a culture. So obviously still wear gloves, but you don't need to open this up, open the test tube, pour it in, and send it to a lab. The vacuum container, poke the tube right in. All right, you guys are free to go. Be on the lookout for an email from me, please, about blood pressures. You'll see that, and then just go ahead and work on. No, go. You need to go. All the computers.